So continuing, now we are talking about the erythroid series. In erythroid series, you have something called the proerythroblast, you have the basophilic erythroblast, the polychromatic erythroblast, orthochromatic erythroblast, reticulocytes, and mature. These basophilic erythroblasts are also known as early, intermediate, and late. So it's easy to remember: early erythroblast, intermediate erythroblast, and late erythroblast. Okay, so now I have made a diagram which will help us understand it much better. So we are going to only focus on this particular line right now. Okay, so erythrocytosis. What is erythrocytosis? Formation of RBCs. Now the kidney, now this kidney will lead to formation of erythropoietin. This erythropoietin will go into the bone marrow, and in bone marrow what happens? You remember there is something called the hematopoietic stem cell. Okay, this hematopoietic stem cell will lead to formation of proerythroblast, see, which I had given over here. Okay, so it will formation of proerythroblast. Okay, that will lead to formation of early erythroblast, intermediate erythroblast, and late erythroblast. Okay, and last is your reticulocytes. So what happens now? We are talking about some important things that happen over here. In proerythroblast, what happens is during this, hemoglobin will appear first. Okay, hemoglobin, small hemoglobin will appear here first. And we need to understand that ribosomes also come. Ribosomes will come in the early erythrocyte. So during this, you have ribosomes. Ribosomes will come over here. Okay, ribosomes come here. And during the late phase, now during this phase, what will happen? See, I've given another image also. So you have to correlate this here. Okay, so here what happens now? Here hemoglobin will start accumulating. Lot of hemoglobin will be here. Okay, hemoglobin accumulates. And in the late phase, what happens? In the late phase, something very important happens. You see the nucleus appearing. Okay, the nucleus that you see over here will start leaving off. So the nucleus will be removed. Okay, nucleus gets removed. Now when the nucleus gets removed, that is, now this will come out. Okay, so it will only, when the nucleus come out, it becomes a reticulocyte. What is reticulocyte? In reticulocyte, you have no nucleus. Cell organelles are there. What is cell organelles? Mitochondria, all those things are now present in reticulocyte. Okay, now this reticulocyte that is inside the bone marrow will come out. Once it comes out into like capillaries or arteries, what happens when it comes into artery? This reticulocyte will stay for a few weeks inside bone marrow and will come out and will stay in the blood vessels for 1 to 2 days. Okay, here what happens? This will become an erythrocyte. Okay, initially erythrocytes are immature. Why are they immature? Because they have hemoglobin. So these have hemoglobin. Erythrocytes have, reticulocytes have hemoglobin. These have hemoglobin, but they only have hemoglobin. They do not have the oxygen carrying capacity. So what happens is, now we will not look at this part, we'll only look at this part. Now what happens is, this erythrocyte, when it stays in the blood vessels for long, like it takes around 1 to 2 or 2 to 3 days, during that particular time, as it moves in the arteries, it will start taking up a lot of oxygen. So that is the time when it becomes a mature RBC. Okay. Now, coming back, I'll explain this once again. In the erythroid series, you have the pro-erythroblast, early erythroblast, intermediate erythroblast. You have the late erythroblast, reticulocytes, and mature red cells. Here, what happens is you have hemoglobin that appears in the early stage. You have ribosomes. Here, hemoglobin will accumulate. Here, nucleus will be removed. Here, no nucleus, only cell organelles. And this, what is mature? Mature is when you have hemoglobin plus oxygen. Okay. Now, this is another image for better understanding. Okay. Now, I have put another image also. This another image will help you understand what step takes place where. So, the hematopoietic stem cell, the pro-erythroblast, erythroblastase, that is the early, intermediate and the late stage. All this and half of reticulocyte will take place in the bone marrow and half of it will take place in the blood. So, reticulocyte will usually spend 3 days in the marrow and 1 day in the blood. And then, when they enter the blood, so the immature erythrocytes will become mature erythrocyte. Okay. Now, we have to read a little about the reticulocyte. Reticulocytes are important because these are normally seen in the peripheral blood. So you should not be shocked. Oh my God, why am I seeing reticulocytes in blood flow? Because they are normally seen in peripheral blood smears. Okay, so this is a blood picture. This is how reticulocyte will look under the microscope. So the normal range of reticulocyte is 0.5 to 2.5% in adults and 2 to 6% in infants. Why in infants it's high? Because they are growing. They are small and their bone marrow is very, very active. Reticulocytes can be counted by vital staining. Okay, so we use a particular dye. Here we are using a dye called methylene blue or crystal blue. Hence it is blue in color, you can see. So we use a staining method. Now, reticulocytes are increased and decreased. Increased in case of acute blood loss. Lot of blood we are losing. So lot of immature red blood. So because we're losing lot of blood, so the bone marrow is going to make lot of cells. Because it's making the cells so fast, most of it are immature cells. So they are like reticulocytes. Okay. Then in hemolytic anemia and in case if someone has severe anemia means all their cells are immature. Long standing anemia, when you give treatment, so slowly by slowly these cells start changing. If they start changing, reticulocytes will be more. Reticulocytes are decreased in case of aplastic anemia, nutritional anemia like iron deficiency and megaloblastic anemia, anemia due to marrow infiltrates like in case of cancers. Okay. Now, what is mature erythrocytes? See, these RBCs you must have seen in your biology. They are biconvex in shape. So what happens? What are the mature erythrocytes? Mature erythrocytes are non-nucleated, means they have no nucleus, they don't have cell organelles.